CityLine, folks. We are doing an ultimate beauty special today. Today on CityLine, we are doing the biggest facial transformation we have ever done before on CityLine. It's going to be amazing. A couple of the people who were responsible for this, Dr. Stephen Mulholland and Dr. Jordan Saul. Hi, guys. So let's get back to our big transformation on the show today. We were transforming Ella. Ella is her name. Fantastic woman, single mom. She hated her looks. She thought she needed a change. So we're going to give you a look right now of what Ella looked like when she came to us and we started with her. This is Ella then. We're going to take a look at the before and after shot. And throughout the show today, we are going to be showing you the entire process, which I imagine, Dr. Steve Mulholland, was a big one. Talk to me about what you first thought when you met with Ella and what some of the challenges might be with this.
Well, Ella was challenging, almost like a Cinderella, really.
Right.
Because many people present to me and they have some aging changes, but the underpinnings, the foundations of their facial form, their skeleton, are favorable. And Ella just inherited some unfavorable characteristics that didn't allow her to ever project that proportion that she always wanted. So her chin wasn't quite balanced with the cheeks, wasn't quite balanced with the nose. And then as you age without the underpinnings of support, things tend to droop a little early.
Right.
So she had some hereditary issues that bothered her, related to skeletal proportion, and then the usual deflating balloon that sinks and deflates as we age. And so what I set out with her was...
So we have so much to look forward to, is what you're telling me.
You know, it's a challenge sometimes to take someone's vision of themselves and make sure it's realistic.
Right.
One thing about Ella is she was very realistic and a real understanding of what she wanted to achieve.
Yeah.
And so we were able to do that, and it was quite satisfying.
Talk to me about Ella, though. Everybody who has met Ella on this set says she is an absolute sweetheart, just a lovely person, a lovely soul. Tell me a little bit about that.
Yeah, she's an amazing person who's risen above some personal challenges like we all have, but have maintained that really outgoing, alive, effervescent personality. And when I first met her, what she projected, what she showed, really didn't match her internal personality.
Right.
When you saw her external form, she looked sad and deflated and descended, and when you meet her, she's elevated and bubbly, and so she had a classic separation of the personality and the presentation. And in our culture, we just don't like that. We like to look as good as we feel.
Absolutely. All right, well, you guys did a fantastic job. Let's actually meet Ella now as she prepares to change her look, starting at Dr. Mulholland's office. Take a look.
Hey, Ella, Dr. Mulholland's ready to see you now.
I'm so excited. I'm getting a makeover. I've always wanted it. My nose I've hated, and over the years of being a single mom and raising my kids, I just came very tired and worn out looking, and I have the gels to prove the tiredness, and so when I look in the mirror now, I don't like what I see. It makes me very sad, because on the inside, I feel different on the inside, and when I look in the mirror, it just takes away how I feel, and then I get all sad during the day or depressed or whatever.
Ella, good day.
Hi.
How are you?
Excited.
Well, today's our big day.
Yes, it is.
Did you get some sleep last night?
Not at all.
Not much. Well, you're about to get some now.
Okay.
So the nose job, or the rhinoplasty, is going to flatten your bridge, narrow your nose, improve that little bulbous tip, and then the endoscopic brow will lift your brow up. Endoscopic facelift will lift the cheek up, and then the lower neck lift with a smart lipo will give you an improvement in the neck, and then we'll add that fat through this hair. And then add some white teeth, and it's going to be a total makeover.
See, and I've told my closest friends, and their reaction was, wow, your prayers have been answered. So they heard me. They did hear me before when I used to talk about it. They didn't think it was some silly thing or a whimsical thing. They knew that it hurt me to look like this, and they were very happy. I can't believe this is happening to me. It just happens to other people. So I feel like Cinderella, and I'm going to be pretty.
Well, now you've met Ella. She's so lovable. Let's take a look at the process of her transformation on surgery day.
Our first step is we are going to contour
Ella's chin, and we're going to remove some of that annoying fat, the waddle that many people complain of, and we're going to use a little laser that melts the fat, liquefies it, and then we remove it gently. Now that we have melted the fat with the laser, the Smart Lipo waddle laser and skin tightening, we're going to take this tiny little cannula and just mop up some of the liquefaction. We have now elevated her skin and reposition that to give her a tighter, smoother jawline.
All right, so you mentioned Smart Lipo. I absolutely have to know what this is. What is that? Is that less invasive?
Yeah, Smart Lipo is, everyone's seen Nip Tuck Extreme Makeover, and it looks like a very traumatic procedure, liposuction. The tendency over the past couple of years has been to a gentler, kinder version of getting rid of the fat. So Smart Lipo is a tiny little laser, about 600 microns, 3 times the size of a hair fiber. You put it under the skin and you melt the fat. So you take the butter, which is your outer thigh or whatever it might be, you put it in the microwave and you melt it, and then you extract it very gently. So it's a 2-stage process done at the same time where you melt and you remove. Less bruising, less pain, less downtime, better skin contraction.
So what would be the difference between all-out lipo?
Well, all-out lipo, generally the surgeon is using their arm and mechanical trauma to take the fat cells out. It's like taking the butter and chopping it up with a knife. It's quite traumatic, and that's the pain and discomfort that everyone sees. Smart Lipo, laser lipolysis, can be done under local anesthesia. You're talking to your physician while it's being done. You can walk out after it's over.
So easier recovery.
Easier recovery, less risk, and better skin characteristics after.
How did things go with Ella? Because you use Smart Lipo on Ella.
I use Smart Lipo to contour under her chin, to remove some of the fat, tighten the skin.
Yes.
And then a little scalp mini lifts here and there to redrape it all.
Now let's talk about people who maybe don't want something even as drastic as Smart Lipo. Are there other things that people can look to do?
Absolutely. I mean, what Ella went through is transformative. It's amazing, but there are risks. There's risks of serious medical illness, of death. I mean, you have to accept this as surgery, and there's risks. We try and do it as safely as possible, but you have to accept those risks. Now, there's many things we can do in aesthetic plastic surgery now that have no risk. We have this thing called the Ultra Shape and the Vela Shape that we use sound waves to melt fat cells like a kidney stone.
Does that actually work?
Of course it works, yes.
Okay,
yes.
sound waves.
Yeah, sound waves. So ultrasound, infrared energy can melt fat. We've got tremendous skin tightening techniques. We've got Botox, we've got fillers. You could look 5 years younger in about 30 minutes with non-invasive treatments.
Right. Yeah. Well, when do you know you need to go sort of beyond Botox?
Beyond Botox, that's a good. That would be a good show.
Yeah,
beyond Botox. when you look in the mirror and you just go, oh my goodness, who is that?
Yeah.
And you're beyond maybe a 3, 4, or 5 year transformative freshness, and you want to take the risk of surgery. You want to turn back the clock on time and appearance, and you're willing to undergo that risk, then you're a good surgical candidate if your expectations are realistic.
Well, we talked a little bit about this before, during the break, and I wonder how many people go in and think, I just want to change myself, I want to change my face. You probably have to have a pretty strict set of criteria in terms of who you accept and who you don't, because some people aren't really dealing with, I want to fix my face, they're dealing with other issues.
Yes, so it's your other issues, you're exactly right. Secondary gain. So a good plastic surgeon, I've been doing this 15 years, you get used to, I'm not going to be able to save your marriage. I can't bring your husband back.
You can't?
I can't.
Dr. Mulholland.
I can't. But I can find you a new one.
Okay, well that's good. That's good.
And I can't get you the pay raise. I can't save your job. I can just help how you feel about yourself. Then you and your healthy mind have to go and change your life.
Okay. Yeah. I want to go back to Smart Lipo just for a moment then. You said that people can leave. You can literally leave right after it's been done. It's
a walking ambulatory oral sedation local anesthetic technique.
Well, then why wouldn't everyone just do Smart Lipo rather than lipo?
They should.
Okay.
Yes.
So can you do my abs after the show?
Well, that would be brilliant lipo.
They're missing. I don't know where they went. Okay, very good. Talk to me a little bit more about Ella in particular. Did you have any problems at all with Ella's? Was it all smooth sailing? Did everything go as you wanted it to go?
Ella was it was a long procedure. It was 8 hours. I was changing the skeletal structure of her face and the soft tissue over it, so it would fall into the big group of procedures you might do rather than medium. But everything went very, very smoothly. She was a healthy person, non-smoker. I do a lot of screening tests to make sure people are healthy.
Does that make a big difference if you're a smoker or not?
Absolutely. If you smoke, there's many things that I probably wouldn't do because smokers just don't heal as well, like diabetics and other issues. So to have a big surgery, you can't be a big smoker.
Okay. And now you said you changed skeletal.
Yeah, so I reduced her nose, I brought her chin forward, I brought her cheeks up.
Right.
And that was at the bony level. And then I rearranged the soft tissue on top of the new bony structure.
How long did it take for her to recover?
Well, it was about 3 weeks till she was looking acceptable. So when you do major surgery, transformative surgery, you need some downtime in recovery. You can't, you read about these weekend facelifts.
Yeah.
Unless the surgeon takes a weekend to do it, there's very few people that look good in 2 days, unless it's really under delivered. So most people think you need about a week off for minor stuff, need about 3 weeks off for major stuff to be realistic.
Now, Ella seems to be absolutely elated with everything that happened. It was just a really good experience for her. Do you ever have people that come out and think, oh no, why did I do this?
I think there's a normal wheel of reaction to any transformation, and we're aware of that, and we help people through the changes. So I would say yes and no. No to those individuals that want a little subtle lift, a little they look the same, just a little fresher. When you take someone who's had a genetic challenge, never had the nose or the face they wanted, and you actually give it to them, there's a psychological shock there. And you need to select the right healthy candidate. And some people are astounded and amazed, and some people are going, oh my goodness, and they're worried that they're going to look so different that people make comments.
Right. Yeah. All right. Dr. Mulholland, thanks so much for that.
Thank you very much, Chris.
We've got a goodie, as I promised during the break. Everyone will receive a sample of 3 products from the Spa Medica Skin to Skin Treatment System. It's a gentle skin cleanser, a pure vitamin C serum, a facial sunscreen that is specially formulated for use under makeup. That's for all of you guys in the audience today. You'll go home with that.
It's been like, to be honest, a roller coaster ride. I was like so excited, and yeah, everybody's nervous about surgery, but the end result is, it's like, what can I say? I'm loving it.
When I first saw Ella, she presented because she was really unhappy with the overall projection of her face. She's one of those classic patients who feels young, acts young, but looks older than her stated age. And so she wanted to look more youthful, And she was in her late 40s, looked like she was in her early 50s, and wanted to be in her late 30s. She was born with some hereditary challenges, nose that was too big, chin that was too weak, a brow that was high and was droopy, and a lot of her soft tissue was just deflated and descended. If you have a beautiful face, everything looks wonderful, and you have...
I just got more self-esteem. Yeah, a lot more self-esteem. And it's going to get better. I just know it.
You've got to be dying to meet her. The Ella we've been talking about throughout the entire show. Everyone, Ella. Give her a big round of applause. Come on up, Ella. You look fantastic.
Thank you.
How do you feel?
Like Cinderella?
Yeah.
Yeah.
You're looking a little like Cinderella.
Well, thank you.
Talk to me about this whole journey.
Oh, this journey has been amazing. My feet has not touched the ground. I'm loving this. I don't walk with my head down anymore. I'm smiling and saying hi to people on the street.
Just strangers?
Yeah, strangers.
Hi, I'm Ella.
Look
at me, I'm pretty.
Getting phone numbers pushed in my hand and getting on the bus for free.
You're kidding me. Get out of town. Are the men all over you?
Oh, yeah.
Well, that is thanks to your 2 doctors. Thank you, Dr. Mulholland and Dr. Saul. You're getting her dates. Good work. Very good. Listen, we chatted a little bit before the show, and
You did.
almost only 2 words came out of your mouth, and you were in tears. This is why people love you, though. You're so happy about this change, and I think that's what people like to see. They like to see somebody who they didn't feel like their insides were being reflected on the outsides, and that's why they went for cosmetic surgery. Is that how you felt?
I remember walking into the office and he said, "What did you want to accomplish?" I go, "For my inside to be like on the outside."
Yeah.
Yeah.
And do you feel that way now?
I do, and more so.
Can I talk to your babies because they're here as well?
You sure
your
can.
2 kids?
You
All right,
sure
let me
can.
talk to them. What's your name, sweetie?
Randall.
Randall, how old are you?
I'm 15.
Okay, so you're the son. Tell me what you thought when your mom said, "I'm going to go in, I'm going to get this done."
Really? I was disappointed.
Oh, really?
And then after to hear her that she said it'll make her happy, made me feel good. So I had to, like, I don't know.
That's all you needed to hear, eh? It'll
Yeah.
make Mom happy and you're happy with
Yeah.
it. How about you? What's your name?
Alicia,
Alicia, how old are you?
14.
Okay, how did you feel? How do you feel about the makeover?
Excited?
Are you excited for her?
Yeah.
Is she hot?
Well, I can't judge her.
I can't call my mom hot. She's absolutely gorgeous. So you're happy for her, though, huh?
Yeah.
Okay, fantastic. So tell me how this has changed your life. Are there things that you're going to be doing differently now? I know you're smiling down the street, you're getting digits from all the guys, and you feel confident about yourself. Are there other changes that are going to come out of this?
The changes that I'm going to try to make. Before I would take something lower level, but now
Yeah.
I'm going to reach for the stars. Yeah, for sure.
And is there anyone that is sort of skeptical about this big change? Is anyone acting a little weird around you now that you're this new fabulous self?
Actually, no.
Good.
No, not at all.
Fantastic.
Yeah.
I'm so excited for you. You're so lovable. Thank you so much, Ella. Stay with us as well. We're going to have the results of our live makeover in the audience, and we're going to talk to Ella a little more after the break. Stay with us. All throughout the show, we've been talking about Ella. We've seen the process of her transformation. Let's just give you a final look at her because it was such an amazing transformation. Take a look at Ella before and Ella now. Look at that. You know, what's interesting about all this is that we've sort of encapsulated this very big transformation. People are seeing it within the hour of the show. And, you know, people don't necessarily get a sense of how big this is, how much time this takes, how much thought goes into it, the recovery. So talk to me a little bit about what people need to think about before they go and do something like this.
Well, from my perspective as the plastic surgeon, it's a big psychological transformation.
Right.
There's a physical recovery. There's a financial commitment. You're basically taking one of the biggest commitments you'll make in your life to your physical self, and you need to set that time aside. It needs to be the right time in your life, and you need to be emotionally and psychologically committed.
What are we talking about recovery-wise? How much time?
If you break the face into thirds, let's say brow, eyes, cheek, and lower neck, each third takes about a week to 10 days. So if you do all thirds, you renovate the whole house, right down to the foundations, it's a month to 6 weeks till you're looking right. And so it's a lot of hiding out period, a lot of recovery period, and it can be amazing, but people have to be prepared for that. There's no weekend surgery recovery for the face, really.
Dr. Mulholland, fantastic job, all on Ella. Thank you so much to Ella, and stay tuned tomorrow. CityLine is home day. Good job, guys.
Good morning, everybody. Good to have you along with us. Dr. Stephen Mulholland is here. Thanks for coming by.
Thank you.
We love when you come and do this. Good morning. We haven't even had a chance to meet yet. What's your name? Sue. Sue. Good to have you here, Sue. Now, explain a little bit what's going to be happening live on the show in the next 45 minutes or so.
We're going to show your viewers the newest and greatest of the immediate injectable fillers. So we're going to build Sue a chin in about 60 seconds.
Unbelievable.
A 60-second chin lift.
That's really what people are looking for now, isn't it? The fact that you can go in, you can have something done fast, and how long will her recovery be?
Her recovery will be looking good tomorrow.
Tomorrow. So you just got back from Asia?
Yeah, I was in Japan, Korea, and Singapore, just teaching doctors what we do in North America here to help people look their best and hopefully feel their best.
A lot of stuff is always being developed. It's amazing. So that's partly what you're finding out there as well, right? Is there one thing that kind of grabbed you that's the latest, hottest?
Well, interestingly, here in North America, we lead on the technology sector, and they're fascinated in Asia by the ability to change and maintain shape. And they usually have nice prominent cheekbones and chins, and so these new families of injectable fillers are probably the hottest new thing out there.
Fantastic. So this is your OR. This is it right here.
This is it, the BTOR.
The BTOR. Okay, I'll leave you to it to get prepped. Thanks for coming today, Sue, and we'll talk in a little bit. Dr. Stephen Mulholland from Spa Medica. 7:52. Hello, everybody. Dr. Stephen Mulholland is here with us, cosmetic and plastic surgeon and surgical director for Spa Medica. Great to see you.
Good to see you again, Liza.
It's been a while. So we're going to be showing you actually a live. What do you call it exactly?
I call this procedure the Voluma lift. It's an injectable facelift in essence, and it uses products that are available in gel form to build up those areas of the face where we deflate.
Which we all go through.
Absolutely. It's like air out of a balloon. You know, as you get older,
everything
it just sinks in. And it's not always the right thing aesthetically to lift without adding that volume to the central part of the face.
So Dr. Mulholland's going to do that live in just a couple of minutes, but we want to talk also about some new things that are coming down the pike. A photo firm, is this like a photo facial?
It's similar, we're now about 6-7 years into the photofacial procedure, which is, there's probably 20,000 photofacials done every day in North America now. And what we, in addition to red and brown discoloration improvements, we like to tighten and firm, and there's some new heads out, some new applicators that are used during that photofacial to tighten your skin.
Right.
So we bring back volume with a new product like this Restylane Sub-Q today, and then we can also do a firm photofacial to tighten. So we can tighten and bring back volume without using a knife.
So you're not getting a facelift result because that's dramatic, but you are definitely, so who would it be right for?
It's right for people that that pass what I call the distraction test. If you can grab your jowl and you pull and you can't see your earlobes anymore and it just keeps going, you know, we can't do anything non-surgical. You really, that's a 911 scalpel emergency.
Right.
But if you just have an inch or two of loose skin and you just want to look your best and you don't want a lot of risk or downtime, then a photo firm, a volume lift, things like that are simple.
Listen, I've tried those photo facials. I miss them. I like them. It's very subtle. It's not something that people just think, oh, you look kind of fresh.
Well, next to our kids, our skin is our most valuable possession.
Right.
And you want to look after it and protect it, and photo firm's a good way to do that.
So let's talk also, it's summer now, so people are thinking about hair removal. There's something called the Comet?
Yeah, the Comet's an interesting device. It combines our traditional laser energy with electrical current. So you get almost like pulsed electrolysis and laser hair removal all in one treatment. So it's good if you have tanned skin. It's good if you have gray, blonde, or red hair, which traditionally we haven't been able to treat. And it just doubles your chances of getting some permanent reduction for your hair because you have the electricity part and you have the laser part.
Oh, okay. So it should give you not necessarily a speedier result, but a longer result?
And usually a more effective result, yeah.
Okay, and this should last for life.
Well, if you kill the hair, it's dead, exactly. Yeah, so on average, 50 to 75% of the hair, if you're white skin, dark hair, will not come back.
Okay, and that's all due to the big pigmentation. You need that sort of pigmentation. Lipo-Lite.
That's going to be, again, a huge procedure, non-surgical liposuction, essentially, contouring fat where you don't want it.
Does this really get rid of cellulite? Because there's been so many things out there, and it's like the bane of women's existence.
It's good for cellulite, but not great. It'll smoothen your skin.
Okay.
But what it's really good at is melting your fat. And some women come in and say, I don't like my cellulite, but what they're grabbing is a great big chunk of fat. Cellulite is that lumpy, bumpy skin.
Yep.
Fat is the wiggly, jiggly stuff under it.
Yeah.
And it's good at removing the fat.
Okay, so you're going to lose inches and have some smoothing.
Without liposuction, without surgery.
Okay, let's go walk over and meet Sue, and you can explain exactly what you're going to be doing today. Sue, you're a champion, by the way. I so respect people who come in and are willing to do this on TV, so thank you for that.
Well, Sue has always complained of having a little bit of a weak profile. If you look at her side view, she lacks the projection to balance what is a strong nose, very attractive cheek, and eyebrow structure. So there's a new product that's called Restylane Sub-Q, which generally lasts about 18 to 24 months. And so it fits that nice niche where people want to try on a new shape. They're not sure they want to do something permanent, but doing it every 3 months is annoying. And that's where this new Restylane Sub-Q is nice for building up chins and cheeks and contours and letting people try it on, see if they like it before doing something permanent or repeating.
Oh, okay. So this wouldn't last forever necessarily?
It lasts about 18 to 24 months, and you get to try on your cheek and your chin and say, yeah, I really like that, and either do it once every 2 years or move into something more permanent.
Okay. I'm going to grab that microphone from you for a sec, Jess, and talk to Sue. So is this something that has bothered you just in the short term, in the long term?
Probably in the long term.
Is that right?
Yeah.
So it's just something where you feel like you look in the mirror and you wouldn't mind a little change. How are you feeling right now? A little anxious?
Frozen.
Very frozen, yeah. Sue seems like she's talking like she just came from the dentist. She's already been frozen.
I put her freezing in, yeah.
Okay, so she's all ready to go. It's very exciting, though.
It is.
Okay, and then you think that how long will Sue need for recovery?
It takes me about 5 or 6 minutes to do the procedure, and then the only unknown is where there'll be some bruising. So I always tell people anticipate the worst and hope for the best. So she may have a little bruising, discoloration around her chin. It's always good to blame things on the dentist. So just say I had some dental work, or I had some gum work,
sure,
and that will get you by.
If you don't want to, yeah, because it's it's your business, or you do it on TV and you don't have to worry about that at all. Dr. Stephen Mulholland from Spa Medica, he's going to do that procedure on Sue right now, and we will see the final result before the end of the show. Thank you. We'll take a break. We'll be right back. All right, lady. Going to caller number 7, who can tell us what is Dr. Stephen Mulholland creating right now live on our show. He is actually doing a procedure for us. The patient is Sue, and we're going to check in with him again in a couple minutes and watch him do this procedure, but we were explaining it. What's he doing? 416-870-7716. Seventh caller to get it right will win. We'll be back with a look in just a second. We're back with Dr. Stephen Mulholland from Spa Medica and our patient Sue, and that really was phenomenally fast. For people just joining us, tell them what you just did.
Well, I'd already pre-frozen the lower part of her chin. I took this new product, this Restylane Sub-Q, and created what I call a volume lift to her neck and chin to create a new jawline. And if we just turn her sideways, because that's the real interesting shot, we'll turn her sideways here, and you can see the difference between her before and after on her profile.
So let's bring up that before, and we're seeing now, and this was like 5 minutes that this happened.
It took about 6 minutes to do a side.
Oh, we'll bring her back forward, just as we bring up the before. There we go. Okay, and then we're going to bring up her picture. And then we're going to get you a mirror, Sue, so you can see this yourself. Okay, so there's Sue before. Wow.
And then after her volume lift.
And then there is the after.
Nice for a 6-minute procedure.
Oh my goodness. All right, let me grab this mirror, because you must be anxious, Sue. If you want to take a look, here you go. Tell us what you think. Go ahead.
Oh my goodness. That's awesome.
Isn't that something?
It definitely is.
Really, it kind of
We should show her profile shot, because that's how patients present this. I really don't like my profile.
Yeah.
And do you want me to turn her?
I think we have that profile picture. Yeah, we'll go ahead and we're going to give you a little spin again, Sue. Let's take a look. There's the profile picture. My
So
goodness.
no chin, no projection, no balance. And
then now we take a look at in 6 minutes.
under local, right in your chair here.
In the BTOR. Okay, so tell me, as you were going through it, obviously there's nerves for anything like this, but what were you feeling? Anything?
Nothing.
Nothing at all?
No.
And that's just a local freezing like you get at the dentist?
Like a dental type of freezing. It'll last about 90 minutes like this. And all of my volumilifts, when I'm injecting whatever product, Restylane Sub-Q or whatever, I do it under local, so people don't have the nausea and the risk, and they can get up and go right home. She may have a little bit of bruising, but she'll be back to work tomorrow to tell her story.
Is this what you expected? Is this what you were hoping for?
Absolutely, yeah.
This end result?
Fabulous.
It really does, Sue. And then now Sue can make the decision whether she wants to maintain this or move to something more permanent.
Yeah, we're lucky in Canada. We have a lot of filler options, and as we age and lose that nice facial fat, we can use a product like this one. The Sub-Q lasts about 18 to 24 months. You may come back and say, I love it, but is there something I can put in last years, or just do this every 2 years?
And what would last years?
Your own fat, or something called the bioalchemid, which is another gel, but it's formulated to form a little capsule around it, and it becomes your chin or your cheek or your nose.
Right, so this sort of filling that you've used today could be used if you start to lose volume here.
Very common. So when I do a volumilift, I basically inject above the eye, under the eye, across the cheeks, around the mouth, jawline, lips, and sometimes even the bridge of the nose.
What kind of price are people looking at generally?
For the long-term, last my whole life product's around $5,000, and for a temporary product like this, it's usually around $2,500.
Do you feel like it was worth it?
Absolutely.
Way to go, Sue. Thanks for being so brave. Dr. Stephen Mulholland from Spa Medica, and you can go to spamedica.com for more information on all of their services. We'll hook you up with that through the BT hotline and website as well. Thank you.
Thank you, Liza.
Thank you both for being here.